New Mexico has a long-standing shortage of healthcare professionals, particularly in our rural areas. This appears to be one of the reasons behind a decision by the state to hire 2 doctors with troubled pasts. According to a story in the Santa Fe New Mexican, it's a great read. I highly recommend it. State officials petitioned the federal government to grant waivers so the 2 can seek Medicaid reimbursements. That would be Dr. Ralph Hansen. He was first hired in 2009, eventually became a regional health officer, and Keith Levitt. He was hired in 2012. He is now the assistant regional health officer in Gallup. Both men needed waivers because the federal government banned them from billing Medicaid for their services because of past crimes related to prescription drug abuse. Now, state officials say they sought the waivers because both men were the sole medical providers in an underserved rural area. Last year, state officials halted Medicaid payments to behavioral health providers on the basis of alleged fraud, and one of those providers questioned why the state went to bat for 2 doctors proven who have committed fraud crimes. Antoinette, that's a good place to start. Is there a difference here? I'm quoting here the HSD spokesperson of some renown right now, Matt Kennicott, who, to my views, just my opinion, somewhat peevishly made a comparison of fraud and just sort of left off the fact that these 2 fellas committed a ton of fraud. What are we supposed to make out of that?
Well, it's such a complex problem, and it's a bigger problem, because you really start with the fact that we can't find doctors to do this work. And this is a sad statement about New Mexico, I think. We don't have the resources. I mean, sometimes I think about, well, maybe the medical school should really, they have a great rural doctor program, but maybe it needs to be strengthened. And it really, there needs to be, accountability seems to be if you're going to take these student loans, if you're going to get this education, you've really got to do what you committed to do at the beginning.
Sure. Rob,
yeah,
I'm sorry.
And I was just going to say, I liked the part where the doctors acknowledged their problems and said, look, I need a second chance, that kind of thing. But really, there's no one in New Mexico who can do this job who doesn't have these problems.
Right. It's interesting, isn't it?
It's complicated.
Yeah, that's a better way to say it than interesting. Rob, I find it complicated and interesting that a doctor who has been banned from practicing in his home state, let's say Washington State, for 5 years, you can come to New Mexico a year later, and a group just sort of looks at you and says, I think we can work with this. I think we can make this work. Well, I don't understand this profession that you can just cross state lines and everything is just hunky-dory.
It's troubling, but at the same time, though, in one of the doctor's cases, there was only one other applicant. And in the other case, I don't think there were any other applicants.
Well, that's what we're being told anyway.
Right, that's what we're being told. But I think that's, we've got, this is an issue that's been coming to the fore for a long time, because we just have a shortage of doctors, especially in the rural areas.
Is this the right way? That's the bottom line question. Is this the right way to address this problem?
Right.
Is it? Well, I'm going to stop you there. Is it really the only way?
You got no applicants and one applicant. It doesn't sound like they chose these guys over 50 other qualified.
Well, we don't know what the process was. I think the bigger issue is there are a lot of docs. I'm less concerned with the fact that essentially these guys' crimes are related to an addiction they have. Both of them had a year of clean time, and they're trying to recover. If folks knew how many docs and lawyers and others are in recovery, and we start disqualifying them from office, I don't think that would be a smart thing.
Let me ask you this on that point. Let me ask you this. We should always bend towards feeling that way. Recovery is possible, right? If you have an addiction, we've all seen it. Recover, and everyone deserves a second chance. The problem for me, Eric, with what you're saying is, it's not just the drug issue and they keep them away from narcotics. You're talking about a person that's had 5, 6, 7, 8 years of professional lying under their belt. They have deceived everybody they worked with forever. And I would like to see a little bit more from our state people to know how this rehabilitation thing goes on that issue, as opposed to the drug issue. I can deal with the drug issue. We can rehab that.
Well, those two are
inseparable.
inseparable. I mean, you can apply the same standard to lawyers, public officials, others who, most people who have the kind of addiction issues that these guys have, they're not exactly, running the choir and doing everything by the book. If they have an addiction, they're writing fraudulent prescriptions. I'm not saying it's right; it's illegal. But the issue is, have they tried to turn things around? I wasn't in any of their interviews. It sounds like they have some kind of program. The bigger issue to me is the hypocrisy in saying we have such a dearth of providers that we're going to bend the rules for these guys and give them a second chance, but yet we're going to cast out numerous organizations who are serving thousands of people who are in dire need, and yet that somehow they're going to be held to a different standard than these docs who screwed up and have addiction issues, and we're going to give them a second chance, but on very sketchy audit information that we're going to disqualify. Some of these organizations that they essentially ended contracts with and maligned in a lot of ways have had decades of really good track records. I'm not saying they probably made some mistakes. Why not say, let's fix this, and so that the thousands of people who have mental health or behavioral health issues who need, frankly, ironically, guys like these docs would have got services.
That's right. Interesting. Dan, I have a question for you. If you were in the medical business, starting your career, looking around the country, you grew up in some place back east, and rural health was your thing. Would you come to a state where literally your boss, your supervisor, could be hired above you within 2 months of being in the state as opposed to you being here and trying to do the right thing? Why would you come here? You see what I mean? Why would you come here for your career if these kind of people are going to stop the upward flow of your career on top of you by having these kind of problems? You get a job in a supervisor's position in 2 months. Does that seem right to you?
I mean, I'm not sure I understand the question. I mean, if I'm coming out here, I'm coming out here for a reason. I doubt the reason is going to be that's going to keep me from coming to New Mexico is going to be because of a recovering addict as my supervisor. I think that
It would stop me.
Well,
I'd choose somewhere else. Okay. Why wouldn't I choose somewhere else?
Because you may not have a lot of choices. Because by the time I'm willing to bet. I did a lot of work with the J4, I think it was a J1 visa program when I was in the legislature in New Mexico, especially in Roswell. We had a hard time getting docs. We had a lot of docs that came from overseas that says in order to be here, you got to work in rural New Mexico.
Right.
The minute the clock stopped, those guys were gone. Right. They're out. So it's not like we got a line of people setting up. I do think, though, Gene, that to tie these guys to what happened, what you and Senator Gregor were talking about, to tie these two together, I don't think is really fair, because I think these guys committed a crime somewhere else, paid their penance, paid their time, they're back trying to rehab themselves. These organizations were caught doing something in New Mexico. So I think at the end of the day, rubbing the two together, do I think the way all of that stuff was handled is 100% copacetic?
Sure.
Not necessarily. But I think at the end of the day, we shouldn't be judging these guys on their past actions if they've cleaned their life up and they're trying to start
Let's
over.
see how it goes. Thank you all for your time. We're going on the clock on the web. Surf over to NewMexicoInFocus.org and check these guys out. It's going to be great. As always, all of us here at New Mexico in Focus appreciate your time and your effort to stay informed and engaged. Catch up with us anytime on social media by searching New Mexico in Focus, and you can find archived interviews and bonus material from our shows on our YouTube channel and at NewMexicoInFocus.org. I'm Gene Grant. We'll see you next week in Focus.